Today, we're really focusing in on a specific source document. It's all about understanding iron therapy administration and effects. Our aim in this deep dive is to basically walk through this source step by step. We want to pull out the most important practical things for you, especially as students learning how to manage patients.
That's exactly right. We're going to trace the journey, you could say, from how iron therapy is given, all the way through how the body processes it, the effects it has, how we track it, and critically, what problems might pop up. Think of it like following the iron once we give it therapeutically, using this source as our guide.
Okay, let's start right there at the beginning then. How is iron actually given? The source kicks off with the administration routes.
It does. So iron preparations can be given in a couple of main ways. Orally is very common. Think tablets or syrups. Then there's parenteral, that means IV into the vein, or IM into the muscle. Though, honestly, IM is pretty rare now. It can be painful, cause staining.
Right, I is much more common for parenteral these days.
Definitely. For oral, you'll often see things like ferrous sulfate, maybe ferrous fumarate. For four, common ones are iron sucrose or iron dextrin.
Okay, got it. So once it's given, especially the oral forms, how does it actually get absorbed? That takes us to step two.
Yeah.
Absorption and getting into the circulation.
Yes, a really crucial step. Oral iron. It's mostly absorbed in the first bits of the small intestine. That's the duodenum and the upper jejunum.
And a four.
Well, RV skips the gut entirely, doesn't it? It goes straight into the bloodstream. But here's a really key practical point from the source. What affects that oral absorption? Things that help it get absorbed include, well, an acidic stomach environment, taking it with vitamin C.
The vitamin C
Yes,
trick.
exactly. And taking it on an empty stomach generally helps too. But conversely, things that really reduce absorption are important to know. Food is a big one. Also antacids, calcium supplements, even things like tea and coffee.
Wow, okay. That's vital stuff to tell patients, isn't it? How to actually take their iron effectively.
Absolutely vital. So once it is absorbed or given IV and it's in the blood,
Hmm?
how does it get around?
Good question. Transport, right?
Right. It quickly binds to a specific protein in the blood called transferrin. You can think of transferrin as like the main taxi service for iron.
Hmm.
Its job is to pick up the iron and ferry it to where the body needs it.
And where's the main destination?
Primarily the bone marrow. That's where red blood cells are constantly being made, and iron is essential for making hemoglobin inside those cells.
Makes sense. And once transferrin drops it off,
Yeah.
what happens inside the cells? Utilization.
Yes, utilization. In the bone marrow, it's used directly for that hemoglobin synthesis, making the part of the red blood cell that carries oxygen. But other tissues take it up too, places like the liver, spleen, muscles. They mainly take it up for storage.
Storage. Okay, that leads us neatly into the next point in the source.
Yeah.
Storage and how the body regulates all this iron.
Exactly. Iron is stored mostly as ferritin, that's like the readily available stash, and also as hemosiderin, which is a bit less accessible. And the master switch, the key regulator, is a hormone made by the liver called hepcidin.
Hepcidin, I've heard that's crucial.
It really is. When hepcidin levels are high, maybe because of inflammation, or if the body already has enough iron, it acts like a gatekeeper. It blocks iron absorption from the gut and stops iron being released from storage. But when hepcidin levels are low, say in iron deficiency, or when oxygen levels are low, like hypoxia, it signals the body to increase absorption and release stored iron.
Okay. So hepcidin explains why someone with chronic inflammation might struggle with iron levels, even if they take supplements.
Precisely. Their hepcidin might be high, trapping iron in storage and blocking absorption. It's a really elegant but sometimes problematic system.
Fascinating. So assuming everything goes well, administration, absorption, transport, use, regulation, what are the therapeutic effects we're actually looking for?
Well, the main goal, obviously, is to fix the anemia. We want to restore the patient's hemoglobin levels and their red blood cell count. And that, in turn, should relieve the symptoms, Less fatigue, less paleness, better ability to exercise without getting short of breath.
Are there typical timelines we expect to see improvement?
Yes, the source gives some guidelines. We should see a rise in reticulocytes. Those are the young red blood cells, usually within about 7 to 10 days. That shows the bone marrow is responding. The hemoglobin level itself. That should increase by roughly 1 gram per deciliter, maybe every 2 to 3 weeks.
Okay, that's helpful for setting expectations. How do we track this? How do we monitor the therapy?
Monitoring is key. We do it in 2 ways, really. Clinically, just asking the patient, are you feeling better? Are those symptoms improving? And then through lab tests, we look at the reticulocyte count, the hemoglobin levels, of course. but also serum ferritin to check iron stores and transferrin saturation to see how much iron is actually circulating.
And how long should treatment continue?
Yeah.
Just until the hemoglobin is normal.
That's a critical point the source makes. No, not just until hemoglobin normalizes. It strongly recommends continuing therapy for a good while after that, maybe 3 to 6 months longer.
Why so long?
To replenish the body's iron stores, just fixing the hemoglobin isn't enough. You need to build back up that ferritin reserve.
Got it. Refill the tank, not just fix the gauge. Now, monitoring also means watching for problems, right? Adverse effects are a big issue.
Oh, absolutely. A very practical challenge. Oral iron is famous for causing GI upset, nausea, constipation, stomach pain, dark stools.
Yeah, that's often why people stop taking it.
Exactly. Poor adherence is a huge problem. The source suggests ways around it. Start with a lower dose, maybe take it with a little food even though it slightly cuts absorption. It might be better than not taking it at all.
Right.
Or try switching to a different type of oral iron prep. For parenteral iron, the risks are different. With 5e, you need to watch for infusion reactions, potentially serious hypersensitivity or anaphylaxis.
Which is why you need that test dose sometimes, like with iron dextrin.
Precisely for iron dextrin. And you can get inflammation at the IV site, thrombophlebitis. If IM is used, which again is rare, incorrect technique can cause skin staining.
Okay. Are there specific patient groups where we need to adjust the approach? Special situations?
Yes, the source points out a few. Pregnancy is a big one. Women often need iron supplements, sometimes higher doses, or just preventatively. Patients with chronic kidney disease, especially on dialysis, often need IV iron, maybe along with drugs called ESAs that stimulate red cell production. And people with malabsorption issues like inflammatory bowel disease or after bariatric surgery. They might not absorb oral iron well, so IV is often preferred or needed in higher doses.
Makes sense. Finally, what about major complications? What's the biggest risk?
The main long-term concern is iron overload. This can happen with too much therapy over time, or in people with conditions like hereditary hemochromatosis, where they absorb too much iron naturally. That's why monitoring ferritin and transferrin saturation is so important, especially if someone is on long-term iron. And another really practical point, drug interactions. Lots of common things can interfere with oral iron absorption if taken too close together. Antacids, calcium, certain antibiotics like tetracyclines and fluoroquinolones, even thyroid medication like levothyroxine.
So spacing out medications is crucial.
Very crucial. Got to advise patients on that timing.
Right. Well, that was a really thorough walkthrough of this source document on iron therapy. We've covered the whole journey: administration, absorption, transport, use, storage, regulation, effects, monitoring, side effects, special cases, and complications.
Yeah, and understanding each of these steps, the potential hurdles, it's just fundamental knowledge for you as future clinicians. It helps you manage iron deficiency safely and effectively.